This is Katelyn Morgan. I am joining you from our KORT Physical Therapy location in Bryan Station. I am also with Miss Holly Ratliff and Andrea Rectamald. They're helping me behind the scenes here. So I also work in Frankfort, Kentucky, just a few minutes down the road, and I am one of our pelvic health specialists. So after physical therapy school, then I have taken about 6 or 7 extra courses, specifically in the area of pelvic health, which we will get into discussing a little bit in just a second. So we've got some questions already that we'll be discussing, but if anybody has any questions, feel free to comment. I'll also be including my email on this later, so if anybody has any questions that they want to follow up with that are more specific or more personal, you can feel free to email me, and I would be happy to help you all with that. So with that being said, I think we'll jump into some questions.
Okay. So just overall, what is the overall description of pelvic health dysfunction?
Okay, so pelvic health dysfunction, in the broad sense of the term, is just whenever the muscles at the base of your pelvis that control bowel and bladder and sexual function are dysfunctional for whatever reason. So they could be too tight, causing issues. They could also be too loose, which would cause more issues like incontinence, something along those lines. So it's a very, very broad diagnosis and very broad topic with lots of kind of specifics within that realm, I suppose. So,
what would be some signs or symptoms if someone's having pelvic floor dysfunction?
Okay, so signs and symptoms. So if you are having any kind of incontinence, either urinary or fecal incontinence, any kind of urinary urgency or an increase in urinary frequency, if you find yourself going to the bathroom more often during the day. Other signs might be pelvic pain, so any pain with intercourse or pain, with a gynecologic exam or something along those lines, that would kind of qualify within that as well. You could also even have gastrointestinal dysfunction, so any like bloating or pain with the bowel movement or anything along those lines would also qualify. Could be some signs and symptoms that you might have, and that's just kind of some general stuff. There might even be more beyond just those few things. So,
perfect. And then, what would be some of the causes of those issues?
Okay, so causes could be kind of like I alluded to earlier. It boils down to whether your muscles are too tight and not functioning well or too loose and not functioning well. So in the one end of the spectrum, if your muscles are too weak and they don't function well with other muscles like your abdominal muscles and things, then you have significant weakness with that, and it can cause incontinence and things along those lines. If you have other end of the spectrum and you have too much tightness, then your muscles are not able to contract or relax fully, and then they can't function to their full extent in that regard either. So if you have too much tightness, when you go to the bathroom, it might be hard for you to initiate a stream. Or if you go to the bathroom and you urinate for a short amount of time and then you stand up and you feel like you've got to sit right back down and go again, in that instance as well, your muscles might not be relaxing to their full capability, and it could be causing issues with that as well. So those two generally kind of cover cover the spectrum of diagnoses, whether wherever you fit along that spectrum.
Right. So if I'm coming to PT, what can I expect on my first appointment?
So on the first appointment, you will get to know myself or any of the other ladies that do pelvic health, specialize in this pelvic health realm. We assess a lot of different muscles as far as like hip musculature, abdominal musculature. We do kind of a thorough like orthopedic exam as well, just to see if there's anything else that might also be contributing to some of your issues. So we would do that. We would talk a lot about maybe bladder retraining or some urge suppression things that you can try, or, just lots and lots of education. This specialty and this topic has a lot of things that people within it that people just don't understand, and truthfully don't even know that is abnormal. So because of that, we do a lot of education on the first visit. We are able to do a internal exam, so that can be part of the treatment, and we might include that maybe closer to the second visit. We typically wait for that because that's a more thorough exam, and so we normally don't do that until the second visit, but that could be part of your treatment as well.
We just got a question in the comments.
Oh, yeah.
Does SI joint dysfunction fall into this topic?
Yes, absolutely. So I'm glad you asked that. So SI joint dysfunction does fall into this topic, especially if it's related to postpartum or during pregnancy. So anything along those lines, there's a specific set of pelvic floor muscles and abdominal muscles that contribute to your stability through your SI joint. So this is something, SI joint dysfunction is something that a lot of, all of our orthopedic coworkers and everybody can treat as well, but it's something that we kind of do have that specialty in just because we have such extensive knowledge in that area.
Perfect. I'm going off the list here real quick. But
Oh, yeah.
I think a lot of women think this is normal, and men.
Yeah.
Can you explain that it's not normal and it is treatable?
Yes, yeah. So this is very much, this is why this is a passion of mine, because, women that live in a bathroom and just think that that's part of their new daily routine, that doesn't have to be the case. And this is something that is not, it's not normal, and it doesn't have to be normal, and it's something that women and men oftentimes don't talk about, and they just don't discuss, and they don't think that there's anything that you can do about it. So that is very much false, and there is something you can do about it, and we see success with all of our treatments that we do, and that's why all of us have kind of chosen this specialty, because we can help extend our treatments and everything to this whole realm of pelvic health, and there's a lot that we can treat that people don't realize.
So how quickly can I get scheduled for a pelvic health appointment, and then how many clinics at KORT have?
Yeah, so we typically can say that we can get people in within a week. So that the pelvic health treatment, you're going to be one-on-one with your therapist in a room. And in general, KORT likes to get patients within 24 to 48 hours, and we strive to do that as much as we can, but because of that designated one-on-one time with the therapist, it might be a little bit more challenging to get that first appointment, but we really truly can get people in within a week. And we really pride ourselves in that, because there are a lot of other clinics that have really long wait lists, and it might be 8 months before you get an appointment with a specialist, which is a long time if you're having some of these issues. So because of that, we really truly strive to get people in within a week. And then what was the second part?
Just how many clinics in
how many clinics? So we have in Lexington, there are 6 of them. So myself here in Bryan Station, and then I'm also, as I mentioned, in Frankfort. We have a clinic in Brandon Crossing with a therapist there named Jordan. There's a clinic in Beaumont Center, and Kristen is at that clinic. And then Eagle Creek, we have Tori there. And then in Richmond, we have Amy. So that covers our Lexington region. And then in Louisville, there are a large number more that I don't know the specifics.
KORT.com.
Yes, KORT.com. You will be able to find all of their information and what clinics they are at.
So you said you treat both men and women. Which clinics treat men?
So Amy in Richmond and myself here in Bryan Station in Frankfort, we both have taken courses specifically designed to treat men. And that can range from the gastrointestinal disorders, or it can range from like urinary incontinence after prostatectomy. So Amy and I both treat those conditions and both treat men.
Okay, so you talked about, well, I know Pelvic Health is also offering tele-rehab. Can you explain what that looks like?
Yes. So with In general, I know all of you have, I'm sure, experienced some of the new tele-rehab options that your physician's offices have started rolling out. So we at KORT are doing that as well. And our clinicians, our public health clinicians are trained for tele-rehab. So that, like I mentioned before, because we do so much education, that first visit, with tele-rehab would be set up much like this video format, and we would kind of get to know you, work through the subjective complaints and all that kind of stuff, and do a lot of education with that. And we could also do a few different muscle tests and walk you through some different exercises and that kind of thing. And then kind of see how you progress, because of the examination and those kind of things, we might ask you to come into the clinic, but depending on the condition, we might be able to just prescribe some exercises that we think would be helpful, and as long as those are working well, then we can do almost a full session and full course of care through tele-rehab. So depending on what's going on, that is an option, and would be definitely available to anyone that is not comfortable coming into the clinic.
On that note, Jim, throwing another one at you. But, could you explain maybe our complimentary consultations if they're on the fence about coming in?
Yeah, so KORT offers complimentary consultations, just like a 15-minute where you can meet your therapist and discuss some things with them. And you might even have questions like, can my condition be helped? And so we can kind of talk to you a little bit and give you an idea of if we can kind of help with whatever the issue is, because this is such a personal and private thing to everyone. It makes it a little bit easier to know the person that you're going to be seeing, and to just open that discussion before just diving right into an initial appointment. So if anybody is uncomfortable, then we do offer those the complimentary consultation. We also will talk to people on the phone. If you have any specific questions, just feel free to call one of our clinics that the public health therapists are located at, and we'd be happy to chat with you over the phone as well. So you can come into the clinic or do that option, but we are happy to do that, just to answer any questions that you might have.
So last on the list, is this treatment covered by insurance?
Yes, so this treatment is billed just like normal physical therapy. So it is billed and covered by insurance. We have a great insurance team that takes care of all of that. And the treatments we do are billed just like any other physical therapy visit. So it is definitely covered by insurance.
Okay, so there's one last question online. How many visits does it typically take to see results? Is it something you're looking at years, weeks, months?
Oh, good question. So depending on the condition, we see results really fast. So it can be within 3-4 visits. Our plan of care is typically once a week, just depending, that can fluctuate and depending on what the issue is. But we see results really fast because there's so much education that we give you. There's modifications that are made right away. And even if the issue is weakness that has been there for years and years and years, the training that we give you and the specifics about, how to do a Kegel exercise and what is involved with that, aside from just doing a simple contraction, you can see changes within almost a month. Can be as fast as 4 weeks. So, and it can go depending on the issue, it can go up to 8 weeks. There are times where you might need 12 or 15. But truly it's not as long as you would think, which is wonderful.
That's very good point. I think that's all the questions we've got.
Wonderful. Well, thank you all for tuning in. And like I said, if you have any specific questions, my email will be on there, so you can feel free to send me those. So we just wanted to remind you all that we are back in the clinic and everything is going great, and we are sanitizing like crazy people, and wearing masks and gloves and all of that just to make sure that our patients are safe. And we are also offering the tele-rehab that I mentioned, so that is something that's definitely available to the public health patient population. We also offer outreach, which is our home health division. So that, unfortunately, we don't offer for the pelvic health specifically, but we offer for any of our other, orthopedic conditions that you all might have an issue with. So if you would like to schedule an appointment, you can give us a call at our 800 number, which is 800-645-KORT, KORT, or you can go to KORT.com.
Thank you.
Thank you.